Avast, ye rapscallions! Hi, Joe Alton, MD here, also known as Dr. Bones of the survival medicine website doomandbloom.net, where you'll find over 1,200 articles, podcasts, and videos on medical preparedness. Also the co-author of the greatly expanded 4th edition of the Survival Medicine Handbook and designer of an entire line of medical kits specifically made for the off-grid medic. In survival scenarios, the sense that will be the biggest determinant of your chances of success is that of vision. Many people have one vision defect or another and would be wise to have things like maybe corrective LASIK surgery or at least some spare eyeglasses in their medical storage. Others with perfectly normal eyesight may end up with a traumatic injury that damages the eye in some way. In this video, we're going to talk about eye trauma. The conformation of the human skull is such that your eyes are slightly recessed in bony sockets. This helps prevent them from injury. Despite this, there are many activities of daily living that can be traumatic to your eyes. Here are just a few of the ways you can injure your eyes. Accidents while using tools, splatter from bleach or other household chemicals, or grease splatter from cooking, splinters from chopping wood, hot appliances near your face such as curling irons or hair dryers. I know my curling iron is a real hazard. The grand majority of these injuries are avoidable with a little planning and perhaps some protective eyewear. Despite this, it's likely the group medic is going to come upon an eye injury at one point or another. Simple trauma to the eye often results in a collection of blood under the skin, a black eye. In these cases, apply a cold pack around the area. Just make sure you don't put it directly on the eye, on the actual area where the black eye is, for 20 minutes to keep down swelling. The injury is serious only if the person develops a double vision or other changes in eyesight. If there's a foreign object in the eye, there's going to be immediate symptoms, including eye pain or pressure, tearing, light sensitivity, frequent blinking, redness. These are things that you'll probably see. The patient will tell you that they feel something in their eye. The most common location will be under the upper eyelid. In these cases, use a moist cotton swab to lift and evert the eyelid. This will allow you to effectively examine the area. Clean, drinkable water can be used as irrigation to flush out the foreign object, or you could use eye wash. They're specifically made for the purpose. Alternatively, touch lightly with the moistened swab to dislodge it. It's rare for a foreign object to actually impale the eye. You would need to have a high-speed impact for this to happen, mostly seen in explosions. To remove small metallic foreign objects from the eye or any wound, an eye magnet or loop instrument can be used. Any magnet actually is useful, but the special instrument called the magnet and loop has a handle that you can hold like a pencil. The handle allows the medic to get close while maintaining direct visualization of both the eye and the foreign object. The tip is dull in order to prevent further injury. The loop side has a small nylon loop which can remove other objects gently. To use the eye magnet and loop instrument, you clean the magnet and loop sides with an antiseptic like alcohol and allow them to dry. Hold the magnet side close to the metallic object to remove. If the metallic object is lifted but not 100% removed, then use the loop side to complete the removal. For other small eye or even wound foreign object removals, the loop can help gently lift them out. Now, I have to say that even in the best of circumstances, foreign objects are difficult to remove without causing scarring and vision loss, especially if it's on the cornea or the pupil. Let's talk about corneal abrasions, for example. Let's say you looked and there's no foreign object. I want you to take a close look at the cornea. The cornea is a clear layer of tissue over the colored part of the eye. That's called the iris. And it exists for purposes of protection to help with focusing. When this layer of tissue is scratched or damaged, it's called a corneal abrasion. A corneal abrasion is pretty common, especially in those people who wear contact lenses. The patient will probably complain to you they feel as if there is a grain of sand in their eye, especially when they blink. Sometimes the injury of an eye cannot be seen easily, and to enhance visualization and help diagnose the issue, a special fluorescein dye can be used and added to the eye. A commercially available and inexpensive cobalt blue light is then used to highlight lacerations. Place 1 or 2 drops of sterile eye wash or saline to this fluorescein strip here. You ask the patient to look upwards, pull down the lower lid of the injured eye, touch the strip to the surface of the eye located under the lower lid, then release the lid and ask the patient to blink a few times to spread the orange dye. Use a cobalt blue light then to visualize the eye. defects will appear bright green. The dye will wash out of the eye naturally, but eye wash can be used if you so desire. The abraded eye needs to rest and heal. After flushing it clean with water and using antibiotic drops if you have them, cover the closed eye with an eye pad, an eye shield, or you can also use, well, if you don't have anything else, the bottom of a paper cup. That can be substituted if an iPad or patch is too painful or just not available. It's wisest to cover both eyes, as the open eye is going to move around and the closed eye is going to follow its movements. As covering both eyes may actually agitate the victim, maybe a small peephole can be made through which the unaffected eye can actually see. This will limit movement but relieve anxiety. Over the next few days, the eye should heal by itself. All you have to do is use ibuprofen for pain relief if you have to. For prevention of corneal damage, you might consider the following. You should wear eye protection whenever you're performing any activity that could possibly cause an eye injury, such as shop work, target shooting, or using power tools. Anyone who's close to you when you're doing these activities should also wear protective gear. When working in the yard, watch for low-hanging branches. Be sure to remove loose objects that are in your path and make sure your kids never point water under force, say from a garden hose, at somebody else's face. Put in contact lenses carefully, don't sleep in them, keep your fingernails trimmed short, employ a grease shield when using a frying pan. These are all good ideas. Occasionally, blunt trauma to the eye or even simple actions like coughing or sneezing can cause a patch of blood to appear in the white of the eye. This is called a subconjunctival hemorrhage, and although it's not painful, it can be alarming to the patient just by its appearance. It's usually harmless, however, and will clear up in about a week without treatment. A more serious condition is a hyphema. In hyphemas, there is bleeding covering the actual iris, the colored part of the eye, and perhaps even the pupil. The patient may experience pain and vision loss. Well, you may wind up with blurry, cloudy, or otherwise affected eyesight. If so, there's more cause for concern. And evaluate this injury the same way you would an abrasion. Treatment for hyphemas involves keeping the patient's head elevated to allow any blood to drain to the lower part of the eye chamber. This strategy might help preserve vision. Cool compresses applied to the affected area are also recommended. Recovery, however, could be very slow. In an event where the eye is exposed to noxious chemicals, burns and other reactions can occur. Rapid action is required in these cases. You want to hold the eye wide open while flushing with warm water. This should be done for at least 15 minutes in severe cases. Avoid getting the other eye wet, as chemical runoff may actually damage it. Eye damage from chemical exposure can indeed be severe, so you have to quickly remove contact lenses if they're there, tilt the head in the direction of the affected eye, hold the eyelids away from the eyeball while having the patient move the eye in all directions. Rinse the area with warm, clean water for 10 to 15 minutes, 10-20 minutes. Wash any eyewear with soap and water and bandage both eyes with a moist dressing. This is Joe Alton, MD. Wow, that was a lot. That old Dr. Bones wishing you the best of health in good times or bad. Thanks for watching. By the way, Nurse Amy has put together an outstanding eye care emergency kit for the family, medic, and survival settings. You can check it out and all our other quality kits at store.doomandbloom.net. You'll be glad you did.